Hello everyone, you're welcome back to part 2 of nursing tips for nursing students. I just recorded part 1. If you haven't watched it, please go watch the part 1 before you watch this, so that way you don't have to miss out. Watch the part 1 tip for nursing students. So in part 1 I said before I go, have you subscribed to my YouTube channel? Please subscribe to my YouTube channel, Health Talk Queen 1, Health Talk Queen 1, and my TikTok, Health Talk Queen. Okay, so now the first one, I talked about the scheduled study time, that you would take it like a job. Okay, if you haven't watched that part 1, go watch it. So the next one is joint study group. Yeah, but this differ from individual. There are some individual that they like to study alone. You just know your body, know your potential, know what you can do. You understand? If you have to study in group to be able to understand the materials, study in group. But make sure in your group you have people that are way intelligent than you, or people who know the materials more than you, so that way you can balance up. But the goal of the group is everybody must pass the exam, and everybody must also be achieving for the same goal, which is passing NCLEX exam. So make sure you know the group, make sure they are serious people of the same like mind, and people who are a little bit advanced than you, so that way it can balance up. And also you want to carry each other along. The next one is determine your learning style. People have different learning styles. Some people are visual, some people they like to write things out to be able to understand. Some people they listen to audio of the instructor. Whatever style work for you, go for it. But I always tell people, regardless of the style that you choose for yourself, the most of the work depends on your own seriousness. So look for what style work for you, and this is you can easily adapt to it once you start the nursing school, and you start going to each class to the next class. You will start know the style that work for you. So make sure you know it and you adapt to that style. The next one is have a nurse mentor. Before you even go into nursing school, make sure you have a mentor. You can choose people that you know they are very reliable, they want you to succeed, and it can be your co-worker, or your auntie that is the nurse, or your social auntie that is the nurse, whosoever that you want to choose as a mentor. Make sure the person has your interest in art, that you can call anytime if you have question, especially dosage calculation. Yes, we do dosage calculation before every class, and it can be challenging to some people who don't like math, you understand, things like that, or they can encourage you. Make sure you have a reliable, good mentor. That mentor preferable can be a nurse, so because that's what you are going for. So it's better you go for the person that is in the same field. Take a break when you are getting stressed out from nursing school. Take a break. It's very important. Once you have vacation, once you have a semester that is on break, you understand, it's usually summertime. Take a break. If it's 1 week vacation, look for vacation. Or if you just want to stay at home and relax, please learn to take a break. If you don't, the nursing school it will force you to take a break, and you will miss some semester, and you don't want to do that. Because in nursing school, if you fail, some school you will not get back, and some school, if they give you opportunity to go back, it's very, very challenging to go back. So you don't want to fail. So take a break. When your body is telling you take a break, just keep that book, relax, listen to your music, do whatever makes you happy, then go for it again, so you'll be able to be successful. The next one is try different study format to see which one work best for you. Try to see if it's maybe bringing tape to the class, recorded tape to record the instructor, but please make sure you ask for their permission first, because you can't record somebody without their permission. Make sure you ask for the permission of your instructor. Then you record the lecture. Because I do this when I was in nursing school, and it helped me a lot. I will put a tape recorder. There's this beautiful tape, because I did my own nursing school years back. So there's this tape recorder that is allowed for nursing school students to bring to class. So we'll leave it in front of the instructor while she's giving lecture, or he or she is giving lecture. Then we play back later. It's very good. It's helpful. I love it. And after nursing school, I just discard the recorder, because I don't like recording. I just don't like. Just like I hate recording. I don't like it. To me, it's my phobia. So I just disregard it. That's why I couldn't give it to people who need it, because it's not my thing. I don't like it. So yeah, but whatever works for you, look for your style and use it. Okay. The next one is get to know your nursing instructor. Yes, get to know them. Get to know them. If you are having problem, especially when you take exam and you know that you need this certain point, nursing school, there is this point you have to get to be able to move to the next class, and it's difficult. I think some schools are different. Some people, I think they have to be 85%. Some people, they have to be 80%. During my time, it was 75%. And for you to even get the 75% in the class is very challenging, very difficult, very, very difficult. So make sure you know your instructor. If you're having issue that you can't meet up, go to your instructor and ask, okay, what materials or what advice can you give me? Before you even get to that point, make sure you already know your instructor, and talk to them and say, what can I do? I don't want to fail this class, because it's hard for me to get in, and if I get in and bounce out, it's going to be difficult for me to go back. So know them, know their materials, understand them. At the beginning, the first day of class, sit down and say, what is my expectation in this class? How am I going to be successful in this class? Who is this instructor? What does she or she don't like? Does she like this? Does she don't like this? Just make sure you know, so that way you can be successful. The next one, take practice in class question. Even while in nursing school, take practice in class question. Get yourself familiarized with this in class question. We have so many books like Kaplan, Sanders, so many that mimic in class question. Get used to it so that you can get comfortable. So when you graduate, when you're about to face that mighty in class exam, you are ready to go. Your nerves and everything will be calm, and you will not be nervous to pass the NCLEX exam. Now, working as a nursing student. I'm going to do another part later, not now. This is going to be different topic about what you need to do. Like, can you work as a nursing student while you are in nursing school before you graduate? How it help you, the disadvantage and advantage. So if you are a working nursing student and you are in nursing school, make sure the job that you are doing accommodates you to be able to study. And if you're working as a nursing student, make sure you're not working as a full-time student. Because you can, especially when you have kids. It's hard. It's hard. But if you can do it, it's fine. But I know most people don't work as a full-time student and also be a student. You can't do two things at a time. One have to suffer for one. So that's why it's recommended that you don't even work at all, but you have to pay your bill, especially when you have kids. So some people work PRN, some people work part-time, but whatever job you are looking for, make sure it accommodates your study time, so that way you can study. And I'm still going to talk more about this maybe in another video entirely. Thank you so much. Till I see you guys in my next video, remain blessed and subscribe to my YouTube channel. God bless you. Bye bye.